Hey, good morning, good morning. Hi, everybody. Good morning. Good morning. Yeah, there you go. Good morning. Hi. So my name is Keith Fiveson, and this session is on healing trauma, ketamine therapy for veterans and first responders. And I'm a veteran, psychedelic-assisted therapy provider, and I'm also the founder of the Work Mindfulness Institute. I'll be moderating the panel today, and first, it's my pleasure to introduce our panelists. And our panelists are experts in their field with a wealth of knowledge and experience on the topic of using ketamine therapy to heal trauma in veterans and first responders. They include Dr. Lindsay Bira, a clinical health psychologist with expertise in trauma, evidence-based treatment, and psychedelic-assisted therapies. Dr. Dana Lehman. Did I get that right? Lerman, okay, thank you.
I could use this too, Lerman.
Dr. Dina Lerman is a medical doctor, a co-founder of Skylight Psychedelics. Jared, got it right, Jared. We talked about that beforehand. Jared Reinhardt, a Marine veteran and ayahuasca facilitator. He's also the lead integration coach for Heroic Hearts Project. And Giorgio Kirlo, did I get that right? Okay.
You did.
I did, thank goodness. He's a retired Marine and advocate for military healthcare reform aimed at prioritizing psychedelic treatments. And last but not least, Dr. Brian Henry, who's the founder and president of Peter Holdings, renowned for his pioneering work in men's and women's health clinics and mental health. Okay, so we've got questions for each of the speakers, and we'll go through the questions, and certainly I'll direct a question to you first. If any of the other panelists have any comments or would like to provide any other insights, certainly do so. We'll see how we can go through the questions and certainly open it up to the audience as we have time. The first question is to Dr. Lindsay Bira. Could you elaborate on how ketamine therapy can be used as a tool to mitigate the symptoms of trauma and how it differs from traditional forms of therapy?
Yes, so this is a very exciting topic to me because I was a contract psychologist for the military and the veteran system for 8 years, delivering the gold standard evidence-based treatment protocols. And I was frustrated because it was very rigid and it wasn't meeting the person where they were at, and we weren't seeing a lot of effectiveness with it. And that was the best that we had. We also had some pharmaceuticals, but even that wasn't good. And then we're seeing a lot of side effects, and then you just add more medications. And so I started to get really frustrated as a psychologist within this system. And so that's when I started my private practice and was able to kind of use different modalities and meet the person in front of me rather than being so rigidly held to a protocol. And so then when we started to see what was happening with psychedelics, and especially ketamine, I had an amazing referral source to send people to ketamine clinics so that they could have a major reset. Now, when we look at the symptoms of PTSD or the symptoms of trauma, so some people do develop PTSD after a trauma, but most people develop other issues after a trauma. It might not be full-blown PTSD, but it might roll into interpersonal patterns, some depression, suicidality, and even anxiety that plays out in a multitude of different ways. So when we look at ketamine, what I think the real strength of ketamine is it goes into the brain, it turns off certain areas of the brain, turns on others, and allows the brain to function differently, which gives somebody, one, a chance to practice different skills in kind of a new state of consciousness, and two, gives other ways of looking at things. So being able to see something from the other side or different perspectives. This to me is almost like an unlocking of consciousness and a new way of being that allows growth. And then we also know that there's a lot of evidence around ketamine helping with chronic suicidality. So when somebody's in a really bad spot, doing these sessions of ketamine, especially the stronger ones like IV or IM, can be a really good way to help the brain let go of those patterns. So we're seeing a lot of good effects with managing some of those symptoms. And I will just say one last thing is being able to go into a ketamine-induced state allows anybody to practice the skills of surrender, trust, acceptance, curiosity, observation. So we're already practicing skills that we know works to develop psychological flexibility, tolerance of uncertainty, and tolerance of distress. So there's so many layers that ketamine can help with in terms of mitigating symptoms and helping somebody kind of develop a new way of looking at things.
Great. I see a lot of heads shaking over here. Does anyone have any additional comments, please?
Yeah, thank you for that. I just always like to add that I think that it's important to highlight the real fact that the way these medicines work, ketamine is no different than the other psychedelic medicines in this way, is that it allows us to connect with our inner healing intelligence, which is not something that we learn in medical school. It's not a concept that we're taught as physicians. And it's really something that all of us have, but we've lost this connection to. So I think that's a really important part. Plus, when we use ketamine for various different indications, all of which are rooted in trauma. So the psychedelic medicines, and ketamine is no different. It allows you to really address the root cause of the issue. And comparing that to traditional, conventional Western approach, where the goal is really to get the person to feel better without addressing how they got there in the first place. So, yeah.
Great ad. Anyone else have anything? I do have a question for you, Dr. Lerman, specifically. Could you speak to how the medical community is evolving its approach to mental health care and how the use of psychedelics in a clinical setting is playing an increasingly important role?
Yeah, I think we're all on board in the fact that it's not moving fast enough. So I was a COVID physician. I saw the COVID vaccines being really pushed through very quickly, obviously, because we needed an intervention for people, but we saw how quickly something can get FDA approved, right? And this pandemic of mental health has been here long before coronavirus and is much worse as we're suffering from the fallout of that pandemic. But I think that we're really realizing, and then we're getting a lot of backing now because the evidence is coming out, but we're really realizing that traditional approach with medicines works about 30% of the time. And then when you add on other medicines, you're increasing the dose, that percentage of likelihood that you're going to benefit from that medication goes down and down. And so we really believe as a community in the psychedelic space that you need to deal with the root trauma to address the issue. And so you can sweep all the stuff under the rug, or you can, with traditional medicines, or you can lift up the rug and let that pile out and look at it, and then it moves through. So,
Great. So, just a sort of a tie-in to that, I want to talk about safe space and about the need to create safe space as a process. I mean, there are many ketamine clinics that are popping up right now with 12 Barco loungers, IV drips, and people come in and they're looking basically for the insurance hit. So I want to get some thoughts about that. Perhaps, Jared, you can add something to that as a Marine veteran. Perhaps you can speak to your personal experience, not only with ketamine, but also I know you're lead integration facilitator with the Heroic Hearts Project. So maybe you can talk about the tool that can be used in that respect.
So what I'm seeing happening a lot with ketamine clinics popping up around the country is it's very clinicalized, it's very sterile. It turns the person into, strips them down into basically like a car that needs to be fixed, and they're getting into a room with a gown and they're putting intravenous, the ketamine in them, and then they basically send them back to a hotel room by themselves afterwards, which I think is what we're seeing as also a proponent of. When ketamine is taken, there is an uptake. They feel really good for about 30 to 60 days, and then it drops back down to the same depression or PTSD symptoms they were having. I think what we're missing here is the key point of integration, and also with groups involved. I know that with veterans, we didn't go to war alone. We went as groups. We heal as groups. We train as groups. We do everything we can in groups. So I think that group therapy is one of the things that would be a huge proponent into that uptake of not needing to go back for more sessions with ketamine, and as well as helping them have a circle of people around them that they could talk to about their experiences.
So Dr. Lehrman was talking about how traditional forms of therapy can maybe take things from under the rug. You look at them and then you put them back in under the rug. What I hear you talking about is really in the integration approach, is to be able to go ahead and look at those things and create new habits, new ways of being, maybe, you know, change your people, places, and things to go ahead and have a different lifestyle. Is that true?
Absolutely. With Heroic Hearts coaches and how our strategy is with ketamine is when the client is going through their ketamine treatment, we usually prepare them for that crash that happens with ketamine. But with that, when they're in that place of like, I'm feeling really good, that's when we start working on mindfulness tools and other ways that they can help regulate that depression or that symptoms that come back, so they don't immediately go, oh, I need more ketamine. Oh, I need more medication. I need more of this. They start to feel empowered in themselves, knowing that the storm is coming and that they can manage it. So through integration and group therapy, I think that that's where the key is to making this a lasting healing.
Excellent. Any other comments, Giorgio?
You know, I think that it's important when, you know, from a perspective of an end user, and I don't want to say an addict. I find myself
misuse. Yeah.
Misuse. Yeah. What I will say is that I take the lessons, the emotional connection, and when I can conceptualize the trauma that I just got through during the session, I take that tool with me and I almost create a totem that lesson I carry on, and it's something that you have to repeat every day. But what I will say is that regardless of that care to it, I do feel myself slipping at times. And I don't know if it's the 30 or 60 day mark. What I'll say is when I feel myself slipping, it's not into suicidal ideation. Now I'm better equipped to understand when the feeling starts. And I think that perhaps I'm just going to segue real quick that this could be a symptom of TBI as well. So where it's not necessarily just the emotional or my psyche or my ego or my soul or whatever, however we define who we are, there just may be damage in a way that I have to repeat it in an episodic fashion. But that's just touching on what you said, that maybe that 60-day crash, for some people, I think it's going to have to be repeated for time. But lessening the suicidal ideation is saying, okay, well, before I get to that crisis ramp, I'm gonna come in, I'm gonna go, I'm gonna schedule a session, and then I'm gonna go through, and then with group therapy, and as long as it's supervised by a doctor, I think that that's something that should be talked about more as well. It's it's not a one-stop shot for everybody. Some people are probably gonna have to do it their whole life.
And I would agree that ketamine is really just a tool in the tool belt at the end of the day. There's so much more that needs to go into it. And it's funny that you had said something about the integration process. I remember my ketamine journey in 2019, pretty new. Ketamine wasn't that explored at the time. And I actually got my ketamine through an online clinic. No integration process whatsoever. Had to figure it out on my own. And I can only imagine how scary that would be with somebody with no medical knowledge. So as time and continuum continues and the community really starts to get behind ketamine, I think that's going to be really beneficial for sure.
That's great. That's great. I want to do a follow-up question for you, Giorgio, because what you had mentioned certainly, and what Jared mentioned, was the whole idea of mindfulness, and certainly that's in my wheelhouse, if you will. So this area of the 60, 30, 60, the feeling of, I call it the feeling of the tsunami coming over the ridge, right? And that's the point of recognition and choice. So I'm wondering, do you feel that through the psychedelic or the ketamine journey, if done properly, that ability to really incorporate these tools is more beneficial, certainly for, I mean, obviously it's beneficial, but the real question is how can we do more of that and really change the mental health role from your viewpoint, being, a veteran and actually going through some serious stuff yourself?
So accountability, I believe the group is so important. The camaraderie that we have for guys that are suffering, they need that brotherhood, sisterhood, they need that connection, right?
Right.
One of the, in discussing mindfulness, there becomes a certain point in time where you have to exercise discipline with your mental health. You have to take that seriously. If we're going to do the treatment and we're going to have this connection, and we're gonna learn the lesson. We have to apply it. Now, if we feel the chemical or the physical damage or whatever it is that causes us to get to that state, that tsunami, right? Whatever your problem is, because it's different for everyone. You have to have the thing that gets you to, recognize that and work on it.
Right.
So accountability in a group is for veterans, guys. We all struggle. I have an accountability partner right next to me right here, right? I think that all of us need to start talking about that. And a one-on-one approach would probably be great for people. Group settings are good too, but sometimes it's a lot easier to share just one dude that you're really close with.
So I like the accountability. Everyone's talking about, set setting, integration, preparation, integration, and obviously, if you will, administration. But I think the one point that you're bringing up is activation, the ability to actively be a part of your own story rather than going back to the matrix that created the problem in the first place. Yeah, and I really do like that. Dr. Brian Henry, you've been a leader in the healthcare area, and you've talked about your own experience. But from your perspective, what impact do you think ketamine therapy can have on the future of mental health care in the U.S.? And how can we work, as a follow-up question, how can we work to increase accessibility to this life-changing treatment for those people who need it?
Sure. So obviously, as a former combat veteran myself, the VA, just like most of us, failed us. So I ended up having to take my matters into my own hands. And as a doctor, luckily, again, I kind of had the accessibility and the knowledge of what ketamine can do. So in terms of mental health in the future, I think it's a massive modality. It's a lot of stigma. It's very stigmatized at this time still, unfortunately. There needs to be much larger community. We need to get legislation involved. There's just so much that we have to do. Because listen, whenever I talk to peers and other doctors about ketamine or psychedelics, I get looked at like I'm crazy. It's absolutely terrible. And again, ketamine literally saved my life. So for the future of mental health, ketamine's absolutely a hot topic. Even other forms of psychedelics, MDMA, psilocybin, et cetera, are also very exciting. I'm a little bit worried about what the FDA might do with ketamine in the near future. Very worried about that. We've been talking to a couple of attorneys that work in this space that say we don't have much longer with ketamine. They may be taking ketamine off the market. So we have to let people know, and we have to get the word out there, and the only way we can do that as a community, of course. So I think it's absolutely, instead of putting a Band-Aid over a bullet hole, we need to fix the problems, fix the traumas, bring up those traumas. Neuroplasticity is so important. But to answer your question, I think ketamine psychedelics is absolutely the future of mental health.
Any other comments? Please contribute.
I just wanted to add something. So I've had a similar experience with other physicians in the space, or not in the space, thinking this is crazy and have gone off the reservation or whatever you want to call it. But there are actually a lot of physicians who come to this also. And I've sat with them in many medicine ceremony spaces. So I think it's our duty as docs to really keep pushing that and not trying to pressure anyone into doing these medicines, but really just sharing our own experience. And they do come, and it's amazing to sit with them in that ceremony space. Whether with ketamine, ayahuasca, psilocybin, it's awesome because we all have this shared trauma, right? Being physicians, or every single one of us has trauma.
Absolutely,
right? So.
Agreed, 100%. But it's about getting out of that stigma. Just like cannabis industry. What is it now? 2023, and it's legalized in how many states now? That I never saw that coming. So it's frustrating being a doctor, and a lot of allopathic Western medicine doesn't really understand it. It's really what we call a pharmaceutical complex. If you have, it's kind of like what we call a war complex. So if there's war, you're going to make money off it. If there's health issues, pharmaceuticals are going to make money off of it. That's always going to happen. That's just the way politics are. But we just have to continue to put the word out at the end of the day and not be scared or stigmatized about our reputation. So,
great, Jared.
Yeah, I think this is a twofold solution here, and I think that all of us at this conference would probably agree that the first step is people need to start coming out of the psychedelic closet. There's lots of successful people in this country, in this planet, who have worked with psychedelics and it's helped them, and they are very scared because of this old stigma. And I think that's changing. I feel like that is changing. People are becoming more open about it. And then the next one is we can't change policy overnight, but what we can do is start setting a standard for the ethical standard for how to use psychedelics and give people a roadmap on effective ways of using it. Because the underground is alive and well, and no matter if it's regulated or if it's illegal or not, the underground is here and it's not going anywhere. People are going to keep taking psychedelics. So if we as organizations, doctors, clinicians, can start setting a standard for the public to start looking at as a reference tool, it might start shifting the consciousness towards this idea of it being recreational or drug use into a healing modality, as opposed to us trying to force policy change too fast, but we can start doing it in an underground market now.
So I want to pull that thread through the eye of the needle here, because one of the things that I'm very aware of as a grandfather and the 16-year-old grandson who's now, going to parties and everyone's using cannabis because it's legal, right? And I see the same thing happening, certainly in the ketamine market and psychedelics market. You can go on Instagram, and I'm sure you've all gotten, requests to go ahead and join some signal group where suddenly the next thing you know, they're pushing, illicit drugs that aren't really legal, but at the same point, you can get them anywhere. So the question I've got is, how do we pull through that education? Because I think it's a huge, you don't get into a helicopter or plane and just say, I'm going to fly it without really understanding how to fly it. So I'm interested in your thoughts.
Yeah, this is something that actually I've been thinking a lot about, because in the clinical psychology community and private practice, we've been consulting a lot about this, because we've seen some really bad experiences when people go in too hard, too fast, without the right structure. And what I'm seeing as a theme here is there's a lot of voice in the psychedelic community that this is the answer, which is hanging a giant carrot, dangling a carrot for the rest of the population who don't have the information, the structure, and the what I am calling healthy trepidation around this. It's all very celebrated and excited, and people are diving in. And in private practice, we're seeing people either going to the hospital system, which they do not belong in, because then they get 5150'd and then put on antipsychotic medication, and now we have a whole problem. We also aren't seeing the structure and support for the proper spiritual support when we have these spiritual ruptures or traumas, which can be absolutely debilitating. And so this is something that I'm still exploring, because I don't have the answers, but I'm seeing it happen. And so I think this is a very important conversation that everybody here too can take a little grain from, that as we move through the world and have these conversations that we all believe in, because there's some real magic and potential here, and I'm very excited about it. And also, there's certain ways to do it right. And I think a healthy level of not fear, but understanding that you can dive in too fast without the framework that supports you. And there can be some real negative consequences with that. And we're not trying to take somebody from relatively functioning in their life to completely not functioning for 6 months. Like, that will never lead anywhere good. And nobody has the finances and support to really get them through that. So I think that something that I'm really trying to figure out my own voice in as a psychologist is, how do I support what's going on and be involved with what's going on, while also having that healthy trepidation to help educate the community that we're not just seeking these experiences in the underground. Do your research, have your community of support, make sure you know the structure, and develop a relationship with these medicines before just completely diving in without knowing what you're getting into.
Other follow-ups? Any other thoughts?
I couldn't agree more with that, absolutely. And again, back to the FDA issue, it's just becoming so prevalent, and the FDA loves to take medications that cure illnesses off the table. I won't go into the reasons. I think we all kind of know why. But again, it's going to be an uphill battle at the end of the day, for sure. That's uphill battle we're willing to fight, for sure. So.
I just wanted to add,
Please.
yeah, I'm a harm reductionist in this space, so I think that the education is really an important part of this. Obviously, we call these medicines and ketamine and all of the other medicines, and I think that so we just decriminalized plant medicines in the state of Colorado, and now we're backpedaling and trying to figure out ways to educate everyone. And because we call these medicines medicines, but medicines come with guidance and information, and not just a free-for-all. So it's our duty in this space to all be really voices of harm reduction and to explain to people. But I also wanted to highlight that I think that a way to really shift the stigma is to teach our children that these are medicines and that it is okay to have these medicine experiences, whether it's ketamine or any of the other psychedelic medicines, that these are medicines, and this is a way that you can actually really heal yourself and move through things instead of just covering it all up and leaving it there.
Georgia?
This is just perspective. I really hope that together, I'm outside of the industry. I really hope together that we prevent this from turning into the cannabis industry. I see that they're coupled in a way, and it's not right. And I'll say I live in Southern California, and I see the undercurrent. It's already there. It's in the smoke shops. It's there, and those are two different things, and they have two different purposes, and they have two different effects. And unfortunately, I could see that it's going to be very easy for the people that pioneered cannabis, which is great. Good on them for getting the legislation done and getting the money, and for where it is now. I'm certainly not knocking the industry. But they already have the framework built of taking something that was at one point in time illegal and taking it to a market, right? So they kind of understand the ins and outs. They already have the networks built. They have the network, the lobbyists built. They have the Congress lined up. They have the state legislatures there. So really maybe engaging them as well, saying like, hey guys, don't put this right next to right next to this and then sell it to the same person for the same reason, because they're two different things. I'd love to decouple them. I don't want to connect them. So.
Also, there is a big shift in the psychedelic space to take cannabis back, because cannabis is a medicine and can be used in the same way and is often used in psychedelic settings. So it's something that a lot of us are working on in Colorado, is working with cannabis the same way we work with these other medicines.
Right, Dr. Lehrman, I'm glad you brought that up, because there is the medicinal side of cannabis, which is not about, just couch locked. You can't do anything. I mean, there's a quality of being able to function, certainly to shut down the default mode network and use it as a tool, as a medicinal tool. Dr. Henry?
I was going to say, in where I'm from, we see abused more than utilized with cannabis. And again, stigmatized, that's all it does at the end of the day. So you got to be really careful with exactly what Georgia was saying here. You got to kind of separate the two, and if you're not going to separate them, you got to make sure you put them in their own boxes, because I do feel like cannabis has been pretty well abused at this point.
Jared, you follow up?
I just want to say for everyone, I know it's easy to look at the cannabis industry and start to kind of look at the negative side, but from the veteran perspective, I know that cannabis has saved thousands upon thousands upon thousands of veterans' lives in our country. It's got them off of hard drugs, it's got them off of opioids, it's got them off of alcohol, and a lot of them that come to our organization are actually looking to get off of cannabis now, and they're using psychedelics, ayahuasca to be specific, to help get off of their cannabis addiction, to get them completely sober and ready to live their life. And so to follow on to the veteran perspective of this thing is, I think a lot of veterans are trying to do psychedelics safely. I think they are a lot, because of the stigma, they're pretty afraid of taking psychedelics. And most of them come to me and tell me, Jared, I'm at the end of my rope. This is my last ditch effort. I've tried everything. I've tried ketamine, I've tried this, I've tried that, I've tried this, I've tried this. I've tried everything. And now I'm coming to you to try to work with your organization, to work with a bigger experience or something that goes deeper. So as far as the cannabis industry goes, yes, it's got its holes, but I just want to remember that it's helping a lot of people, and they have provided a wonderful framework for us to move through, and we can learn from their mistakes that we've been seeing earlier.
Okay, I want to ask, well, certainly, we've got lots of more questions that we can ask our panelists. Does anyone have a burning question that they'd like to just ask? Sir, in the back, I saw you first, please. Okay, so the question is what determines how much ketamine to take? Is there a microdosing or is there a protocol specifically for the individual? Yeah?
Well, I think any good physician is going to start low and work your way up. That's the way we like to do it, is start low and work our way up. Everybody's biochemically different. Of course, other doctors, I'm sure, would have their opinion as well.
Yeah, I think it's a very individual approach that's important with all of these medicines. So it depends on what's happening with the person. Are they struggling with suicidality? Are they struggling with addiction? What's the level of anxiety going into a non-ordinary state of consciousness? The body weight, I don't really bring into the equation so much, but it does play a role. What other medications are they on? Are they on Lamictal, which is going to blunt the response to ketamine? So, it's a very individualized approach to these medicines. There are places that'll go in, and no matter what's going on in your life, they will give you 50 milligrams of ketamine. So it's really important to do your homework and really establish what their practice is. But I agree in that starting off lower and really allowing people to develop that trust with the medicine. And that's the same with any of these medicines, right? Developing the trust, making sure that they trust the container in which they're being held. And then you can increase the medicine as they move through the protocol. Plus, a little bit of tolerance develops when you're using the ketamine, so we oftentimes increase it as we're going forward.
Yeah, and I think that area of the container, please, Dr. Bira.
I was just going to say that I agree with all that, definitely. And of course, as a psychologist, I don't have the training in the medicine side of things and the dosage. But what I do see is that, one, people need to develop a relationship with it and kind of get used to that feeling. I don't see much benefit in microdosing ketamine, and I don't know how. I actually have seen a lot of problems in that. So I've had people come into my private practice who got prescribed a microdose, the Spravato nasal spray, and it's actually caused some weird anxiety and dissociation that they can't shake. And so I think that that's where we're having some misinformation and some fear about doing the actual experience that's trapping somebody in a microdose. It's actually much not helpful, right? So I do think that we have to do the more macro dose, but it is about developing a relationship, because what we're trying to step into is the trust model and some of the surrender into the non-ordinary states. The moment that we get into resistance, that's when some weird things happen. But behaviorally, we have to train the nervous system to feel safe and okay, and that's why the space in the container is so important.
Right. I mean, it's about being disembodied, being unattached, and, through the process of creating the safe container, we have an individual who can go ahead and start to go deep into all of the issues that might have been, really plaguing them, right? So.
And microdosing, I think, is going to increase the risk of addiction.
I have yet to see a study on microdose. So there's plenty of studies, over 500, I believe, on macrodosing. Not yet a single study on microdosing. So as evidence-based, I'm just not really for it.
And just because people are doing it, and just because there are physicians out there that'll prescribe microdose ketamine, doesn't mean that it's good for you, right? Just like there's plenty of bars that we could all go into, and doesn't mean that that is good for us either. So it's really important to check in with yourself and why you're coming into the medicine, and really, besides addiction, there's one practice out there that's prescribing a lot of ketamine to be used every single day for people. I had someone just come to me who's been on 120 milligrams of ketamine for 3 months.
Wow.
And so that not only is going to increase this, he's 20 years old, but his likelihood of being addicted, but is also probably going to increase his risk of having some side effects to the medicine. So.
Great. There was another question, I believe, right there. Yeah, please, we'll do that. I can't hear you, I'm sorry. Is there a question? Okay. I'm sorry, I can't hear you. I apologize. Yeah, you want to take the mic, please? He's better looking than I am, clearly.
Oh, come on now.
Whoops.
So I really liked what you said about the trepidation at the threshold. And one of the things that happens, I've been a psychonaut for a long time, before all these terms came in about macrodosing. And oftentimes I would find that microdosing, if you took too little, you didn't get over the threshold where you had the breakdown of your personality. And that breakdown of your personality is a spiritual breakdown. And what happens when you come out of it is you go into sometimes very dark spaces because you have to reintegrate your personality or rebuild your personality. And it's a long process, and it's a spiritual process. And the conversations are spirituality is marginalized in the conversations that are happening around psychedelics, when spirituality is actually the main thing, the thing that makes entheogens powerful in our society. And because we live in a secular state, and religion is in this camp, and medicines are in this camp in healthcare, the two are separated, but in our own psyches, they're not separated.
So I want to recap that. Thank you very much for that question. And I just want to recap it in different language. Dr. Joseph Campbell once said that the difference between spirituality and religion is the difference between religion being the menu and spirituality being the meal. And I really have heard within the group here that one of the key components is community. And that camaraderie, that ability to conspire, to aspire, to be inspired, all around breath work, all around individual sharing and having a common bond. So I want to sort of pull that thread through here, because we do know that, it's been said certainly that the issues with addiction or misuse are really connection issues. Community issues. So why don't we sort of talk to that for a moment, just to honor the comment, and what is the, is the medical model the right model, and how can we bring in more community and more spirituality into that model without having to call it X, Y, and Z religion or whatever?
Well,
Giorgio, please.
I just have a quick comment, sorry.
Yeah.
I'm a Christian, I'm a Catholic, practicing, read the Bible. I wasn't connected spiritually and had a relationship with Jesus Christ, who this is my beliefs, as much as I was after the first time I did ketamine. And I do believe that when we look at other addiction treatment programs like AA, or Narcotics Anonymous, they are centered around a relationship with a higher power.
Higher power, yeah.
And that's something that if we could treat our mental conditions in a similar manner,
And there's testimony there, right? I mean, people are sharing about their strength, hope, and recovery.
So when I go into a session, I come out of that more connected in my faith, in my relationship with Christ,
okay.
And I have no fear in saying that. And it's something that is probably unspoken at the conference, but every single one of us, I think, probably has a higher power experience. Whichever you choose as your prophet, it's important not to war over it, but there is a spirituality there that you're not going to get in the medical setting.
So it's Giorgio, that's been very helpful for you.
It's not going to be introduced to you.
Right.
Maybe it's something that it comes in that accountability group, and that's I would love to talk with more Christians about ketamine. I tell him, I say, ketamine in Christ. Ketamine in Christ. It's something that it brings me closer to God, and it also helps me heal. And
that's been a good path for you. It's really validated and provide a good foundation for your walk. Yeah, please.
And I agree. Listen, there's no atheist in a foxhole, okay? We've been in combat, so we kind of understand this, obviously. But really, I think the ketamine brought me closer to Jesus. I kind of let myself go there for a little while, and ketamine definitely does connect me to that higher power that we all have, no matter what religion you may have. Everybody has that higher power that we look towards, no matter what it is.
Aspiration. Please, Jared.
So when we're talking about spirituality, I think we're really talking about an individual's personal relationship with the world, or with their idea of the universe, what that is for them, whether they put a structure around it with religion or anything else. But when it comes to psychedelics, it can help break through that, and then they start developing a personal relationship with their place in reality. And I want to, as a combat veteran myself, I just want everyone to know that foxholes, in general, they usually create more atheists than they do anything else. Like, I know most of the Marines I served with went in with deep spiritual meaning. After they come back from war, they had nothing. They didn't care. They were complete atheists. Mm-hmm. So that's a bit of a misnomer we hear. But in the thick of it, you're praying, right? Like, hey, don't hurt me. But when you come home, you're like, what kind of a God would do that? So I think psychedelics are a method to help people start developing a more personal relationship with the whole of it, with their community, with their country, with everything else that comes along with it, and with some guidance along the way from other people who've been through it.
Through connection, the ability
through
to
connection
connect.
and community.
Yeah. Please, Dr. Lehrman.
I just wanted to add that recently I had an experience in ayahuasca ceremony where my takeaway was that the answer is not in conventional Western medicine approach, and the answer is not exclusively in psychedelics. The answer is in the middle, because there's a lot of benefit from both sides. And so I think that as physicians and people in healthcare and the mental health field, it's really important for us to bring ceremony and the things that we've learned into the Western medicine arena, really, and bringing back intention, right? There's no reason why when my husband does a surgery, they can't have a moment and right after they make sure it's the correct patient and the correct limb that they're amputating, that they can't set an intention for the surgery. Who is this person? What are we doing?
Yeah.
Take a breath and connect as a community with this person that is in front of you, with your team. Like, that's what we've lost, is that connection.
Right.
And I think that psychedelics help us to get that back, our connection with ourselves, with our community, with the plants, with the animals, with all of it, because the foundation is broken, the connection is broken. And so these medicines allow us to reconnect.
Create a safe container. Yeah.
Right.
Can I add
Please,
one thing to
Dr.
that?
Bira. Yeah.
So yes, I think this is such a powerful conversation, and I think when we talk about psychedelics, we absolutely have to be talking about spirituality, if that can be helpful to somebody. And when I've seen some things with the higher, more intense psychedelics like psilocybin, high-dose psilocybin, and ayahuasca, there are things that can be presented to people that can actually be spiritually disrupting. So they might come in with a certain knowledge or framework around what God is and what spirituality and their religion is, and might even feel pretty strong in that. And then they're presented with something that is completely, universe level, mind blowing. It completely disrupts that framework. Now, that can be difficult, but it might not necessarily be a problem as long as we have the right integration support that incorporates spirituality to help make sense of that experience, because it's so much other than what we're used to or what we're taught about, right? So I think this is kind of weaves back in these like bad experiences or these like really deep trips that disrupt people. It is so important to be able to digest that and make sense of it. And I think being able to find people who integrate the spirituality pieces, whether it's your higher self, higher being, universal love, whatever that is, to help make sense of it is going to be key. So I think just to kind of remember that it's not necessarily having this experience and definitely getting more in touch with God. It can also be having this experience and saying, wait, what the F is actually going on in this universe? And I need help to understand this. So I think as long as we just understand that range, now we have power and tools to seek out the right support and develop the right support.
I had a aha moment not too long ago in terms of my practice, looking at my own psychedelic experiences. And I graduated high school when the Pink Floyd album "Dark Side of the Moon" came out. Breathe, breathe in the air. So I found out that the root word for breath is spir, S-P-I-R, as in spirit, as in inspire, as in aspire, as in perspire, to be able to sweat your prayers into the world. So I think when we go through a journey and we suddenly everything looks like it's breathing. I don't know if you've had that experience. I'm sure you have. Everything is breathing. That is the ineffable. That is the spirit that I think we all want to connect with, right? So I'd like to continue now that I take that little segue. Sorry about that. My question, Dr. Bira, is what are some of the symptoms or conditions that ketamine therapy can target, and how does it compare to traditional, treatments like therapy or medication? Specifically, what I'm looking at here is PTSD, trauma, suicidal ideation, treatment-resistant depression, and so on. I don't know if I just stole your thunder. I apologize, but jump into it, please.
Yes. So I'm going to boil it down into something very simple, which is rigidity. Okay? So when we look at diagnostic disorders and dysfunction, there's a lot of rigidity. Rules about what's safe, rules about trust, and the world becomes like very much Like people can't access the world and joy and freedom because their brain is making so many rules, right? So when I think about ketamine and other psychedelics, it actually kind of punches holes through a lot of those rules and rigidity that allows people to say, okay, maybe I wasn't completely correct in that. Maybe I can step into more of a sense of love, or actually I just experienced wholesome love through this experience, and now I see that if I move through the world with that, I'm actually eliciting other responses from people and spaces in the world that's going to feed back into my life in positive ways. So when I answer the question about symptoms, when we're looking at anxiety, suicidality, depression, PTSD, which is about safety and the brain being hijacked into that fight, flight, or freeze response all the time. I think that ketamine, again, allows us to step into a state where we say, maybe I don't need to be like that. Or, wow, this is what pure love feels like, or this is what this other emotional state feels like. And that lingers because we're also inducing neuroplasticity with growth factor that gets released when ketamine and other psychedelics are in our brain. So the experiences that somebody can have, especially in a safe container, can definitely translate into real life. And then we integrate with that. So again, working with a one-on-one specialist who's familiar with your issues and how they're presenting, because not all PTSD cases are the same. They all present differently, right? So everybody has something different to work on. But working with somebody one-on-one that helps integrate that is really where the power happens, because you can integrate leading with more openness or love or curiosity or understanding that, moving through the world with a look of distrust is going to cause the world to react differently to you, right? So I think it punches holes in the rigidity that actually maintains the disorder. And that's where we start to have some growth and openness.
So the neuroplasticity through that process, being able to make new connections and so on, really helps to change behaviors and really modify what was sort of set in stone, now making it more fluid, yeah? Dr. Lehrman, I question for you. Could you speak to how the medical community is evolving its approach to mental health care and how the use of psychedelics in a clinical setting is playing an increasingly important role?
Yeah, I think we touched on that a lot so far. It really seems like there is a shift that's happening from moving from these traditional talk therapy and SSRIs, SNRIs, all of these psych meds, to really trying to look at the person as a whole and to get to the root of the issue. And oftentimes we do this, and it's not only psychedelic medicine is not the only way to get to the foundation of issues. Like there are other things that many people do, breath work, many types of non-medicine ceremonies where people are able to get into these non-ordinary states of consciousness. But I think the shift overall is, instead of sweeping stuff under the rug, just lifting up the rug and getting that pile out and looking through it, I think is really what the shift is and what we're doing now.
Great. And Jared, oh goodness, old habits. So as a Marine veteran, I'm wondering if you can speak to this next question, which is, but it goes out to everyone as well. What would you say to veterans and first responders who may be hesitant or skeptical about trying ketamine therapy, and what can they expect from the treatment process?
First of all, I would, if I was talking to an individual, I would want to know their intention for doing so. Like, what are they looking at getting from it? And then asking, what do they know about it? And a lot of that fear or trepidation for the treatment comes from, I don't know what's going to happen. And most of the fear comes from the unknown of the experience. So I would say do your research, make sure that the clinic has, or the place you're going to, has a robust integration program. It's not just going to be an in and out process. You have someone to be there with you, and if you don't have that, let's find someone for you, and going from there, because I think that's where the gap that we're seeing in this is, and then the policy's not even making this as well, is that there doesn't need to be any before or after action with an individual going through this process. So I think them feeling taken care of would help mitigate a lot of those fears.
Yep. Any other comments?
Yeah, I would say not only retired veterans, but how about the individuals currently serving on the front lines today? The stigma there, just, my goodness, it scares me just thinking about it, being a former military. So really, I guess you could say Giorgio spoke really well on this on his keynote the other day about how the VA just throws a triage of medications at us because that's what they're trained to do. But at the end of the day, what if we're able to currently treat our current veterans and our current first responders out there and not have them be stigmatized as, oh no, I'm going to lose my job, I'm going to be looked down on from my superiors, et cetera. But it really needs to start there, not just the retirees, not the guys that got out. It needs to start there with the active duty as well.
That's great. And finally, Giorgio, how do you think advocating for psychedelic-assisted therapies can help transform mental health in your experience? My question really comes from what we've been talking about, or certainly my key bugaboo, which is what General Stephen Zanakis talked about, which is the fact that we are now sending our veterans offshore for treatment, psychedelic-assisted therapy, because there is no insurance, really blanket insurance or coverage from the VHA or from insurance companies. So, this is one of my missions in terms of this conversation, is to really talk about how we can have that grassroots effort, if you will, and I'm just wondering what your thoughts are specifically.
So I think we need to engage with professionals that look and sound like the legislators. And when I say that, we talk about stigma, right? The cannabis industry has a stigma about it. Most of the people that you engage with in the military are terrified of change. They are paralyzed by it. And the older and the more set they get in their ways, the more that something like this is an impossible bridge to cross for them in their mind. And they will instantly shut it down when the conversation starts, because it was not introduced to them at an early point in time in their career. One of the things that, quite a few of us, we're all aware of trauma prior to the military, right? And one of the things that I talk about is, well, the childhood trauma that I had probably had a bigger impact on my time when I left the military after my entire career. So intervention, I believe, in the military has to take place way before crisis. Education has to take place way before crisis. A grassroots movement also has to be within the medical community, within the VA, just like everybody's saying, hey, let's get doctors to go do this so they could, see what it's like, so this way they know that you pull down that wall. But from a legislative aspect, it has to be a professional and combined effort from, I can't tell you how many organizations there are here that all want to help. We're all under one roof here and there, but, I think it has to be a massive combined effort.
Right.
It can't just be grassroots. It has to be professional. It has to have big money behind it.
Top down, bottom up.
And that's what I'm going to say too. Is like, we got to start putting money behind this thing. Right. And it just because I work in politics. We got to start putting money behind this thing. We got to start paying the lobbyists the right way, and we got to start getting guys like Brian in front of Congress to testify. But grassroots is important too, because again, grassroots. I think the earlier engagement, saying like, hey. You probably had some, one out of every 4 guys that join the military have an immense amount of trauma. Right. You probably should go talk with a mental health professional now, before you go to war.
Right. Interesting. Other comment? Brian?
I was going to say, on your point of these, I guess you could say, organizations sending their veterans to Mexico or Brazil, et cetera, that's not cheap. That's expensive.
No, very expensive.
There's always so many tickets that can be punched in order to do that. So, again, we got to get behind this at a legislative level, or else that one person you miss could be one too late. We don't want to lose any more, so...
Yeah. Any other comments before I want to ask if any of the audience members have questions?
Yeah, I just want to say that psychedelics or healing itself should not be just for the rich. And believe it or not, people with PTSD usually are not doing that well financially. So I think that having an insurance for it is something that needs to occur, and we can work on that. But until that time, it's us as a community, we can lean on nonprofits and other things to help bridge that gap until we can start making that headway. Because as he said, and anybody who's worked in the government industry knows that they're afraid of change, and it's usually the last thing to change in our country is our government agencies. So Until that time, I think a call to action for everyone in this conference and in our country is let's lean on our nonprofits, let's lean on these other organizations that can fill in that gap for people so it's not just for the rich to be able to go fly down to Peru or get thousands of dollars of treatment that they can't afford.
Hey.
And then have to pay for integration support because it's, there's an issue there.
Yes. Dr. Lehrman, one other comment?
I just wanted to give a shout out to the company called Enthea, which offers, for those of you who don't know, Enthea offers ketamine coverage through people's employers, so they can work with your employer to cover your ketamine treatment. So that's something that's important. But also, there are plenty of providers who are in our country who are doing really amazing underground work. And so I think that if someone doesn't have the financial means to go out of the country, I just would suggest you reaching out to your community. There's psychedelic communities that are pretty much in almost every state now. You just have to look, and then do your homework in terms of where you feel like you should go.
Okay.
I also want to give a shout out to 2 organizations who offer free integration support, which is Fireside. And apparently they have more facilitators than they have people coming in. So there's some openings there. And then also ICEERS, which offers 5 sessions of free integration support. So I really like this conversation because it's something that I've also struggled with. It's expensive to have these experiences. And then it's expensive to get the integration support. And people don't realize that. So people are left stuck. So I think this is very important.
Fireside, and what was the last one?
Fireside, excuse me, and ICEERS, which is ICEERS.org.
ICEERS.org. Okay, great. So we have time for 1 or 2 questions, perhaps maybe 1 question.
Who's got a question?
Anyone have a question?
Here you go.
No.
Hi. Are they doing, I think that they're doing some research in the VAs, like in Texas, and there's another VA where they're doing research.
Yes, it's very covert and on MDMA, yes?
Okay, so that's a start, right? I wanted to know what you think about that. And also the Center for PTSD in Vermont, they're talking about psychedelics as the VA Center for PTSD, National Center that through the VA is talking about psychedelics and treatment for PTSD and how it's like just, it's around the corner. So I felt really positive and enthusiastic. Like, oh my gosh, maybe, it's really changing. So
let me reframe your question. So other than Enthea and obviously these other organizations, I'm familiar with one research study that maps on MDMA through the VA, but are there others that you're familiar with as well? And the availability, please.
Yeah, I'll just be real quick. So Heroic Hearts is partnering with the Portland VA right now to start with psilocybin studies and treatment. They want to adopt our integration program on top of their clinical testing and the trials that they're doing with psilocybin.
Great.
And we are also working in Oregon itself and sending now Oregon veterans to do legal psilocybin treatment along with a robust integration program that we surround them with. So it's occurring, and as the organizations are out there, especially with veterans, we are making sure that it's done properly and that they're not, when the VA starts to move into this direction, they're not going to hopefully drag their feet or harm anybody in the process.
And Giorgio, you have a comment you wanted to add or anything?
Okay, so understanding that we have to research endlessly, I think we know this works too. And the longer we concentrate on funding certain studies, I think the less we concentrate on funding legislation or efforts to get this. This is life-saving care. It interrupts a crisis cycle. And when I look at the community as a whole, I'm not going to talk poorly of it, the medical community as a whole, but what I will say is that we have veterans and active duty members that are killing themselves at an immense rate. And when I say that, we brought a product to the market for a the vaccine quickly on mass scale. I know we have to do research, I know we have to fund it, but the fact that it's not being administered on grand scale right now is absurd. And that call to action, we could talk about research, but we know it works right now. Let's get guys and girls that are going to commit suicide, that have tried other things, let's get it to them right now. So VA, great. I'm glad that we're doing the research. I'm glad that we're doing the tax dollars for it. We know it works. And then second to that, it's not killing people like these other drugs. It's not. It's just not killing people like SSRIs are. It's just not. It's the bottom line. So, yes, love the fact that we're doing research, and we have to continue to do it, and we have to continue to call for it, and we use the research against pharma to say, look, this works better, right? But let's not get too caught up in the cycle. Let's say that right now we want to say this is an emergency. We have a crisis on our hands, and if we treated it like we did the COVID vaccine, maybe we'd be better off.
Right.
In the veteran perspective.
Yes.
In the veteran perspective.
Well,
Amen.
Well, on that note, I'm afraid that's all the time that we have. I do want to thank our panelists. And just a note, they will be here. If you have any questions, please come up. And also just echo back that, change that we really would like to see is up to all of us. While we're just highlighting some points here of discussion, it's really up to us. If you're able to, write your congressman, your senator, do whatever you need to do and be a voice for change. I want to thank you all very much for being here. Thank you.